What is pregnancy? Pregnancy is a biological process that occurs when a female's reproductive system undergoes a series of changes that result in the development of a fetus within the uterus. It typically begins with the fertilization, when a sperm cell joins with an egg cell in the fallopian tube. The first fertilized egg then travels down the fallopian tube and into the uterus, where it implants in the uterine lining and begins to develop. During pregnancy, the female body undergoes numerous physiological changes including hormonal changes, weight gain, and expansion of the uterus. These changes are necessary to support the growing fetus and prepare the body for childbirth. Pregnancy lasts an average of 40 weeks divided into 3 trimesters, during which time the fetus undergoes significant growth and development. Pregnancy can result in a wide range of physical and emotional experiences for the mother, including morning sickness, fatigue, and mood swings. Ultimately, pregnancy culminates in childbirth when the fetus is delivered from the uterus and enters the world as a newborn baby. Which doctor to see when pregnant? During pregnancy, it is important to consult with various healthcare professionals to ensure the health and well-being of both the mother and the developing fetus. The obstetrician and gynecologist, are also known as the OBGYN, are specialized in the female reproductive system and provides medical care throughout pregnancy, including prenatal care, delivery, and postnatal care. They also monitor the progress of labor and delivery. They provide pain management and perform cesarean if necessary. They also provide counseling and education on topics such as contraception, family planning, and prenatal nutrition. What types of pregnancies are high risk? A high-risk pregnancy is one in which the health of the mother or the developing fetus is at greater risk of complications than the typical pregnancy. Signs and symptoms of pregnancy. Missed period. One of the earliest signs of pregnancy is a missed period, although this can also be due to other factors such as stress or changes in weight. Breast changes. The breast may become sore, swollen, or tender, and the nipples may darken or become more sensitive. Nausea with or without vomiting. Many women experience nausea and vomiting, commonly known as morning sickness, particularly in the early stages of pregnancy. Frequent urination. Increased urine production and pressure on the bladder can cause pregnant women to urinate more frequently. Fatigue. Pregnant women often feel more tired than usual, particularly in the first trimester. The medications prescribed during pregnancy may vary depending on the individual needs of the mother and the developing fetus. Here are some common medications that doctors may prescribe during pregnancy. Foods allowed and not allowed during pregnancy. Vegetables, cooked meat, fruits, milk, foods that are high in vitamin B, C, K, and magnesium. Foods not allowed during pregnancy. Alcohol, raw eggs, high mercury fish, organ meat, caffeine, undercooked and processed meat. Demographic design of the patient. Here is Mrs. Rovelyn Falconet, a 31-year-old with the following vital signs during the interview. Temperature 36.8, respiration rate 18, pulse rate 85, blood pressure 120/90, body weight 50 kilos, height 5'1". She is on her 3rd pregnancy and currently on her 3rd trimester. Diet prescribed by physician. Eat plenty of fruits and vegetables. Dairy foods such as milk, cheese, and yogurt. Low-fat milk varieties. Reduced fat cheese. History of present illness. GP3, para-2. Medication. Vitamin K, folic acid, ferrous sulfate. Income, housewife. Physical activity, moderate, mother of 2. Here are some computation for Mrs. Rovelyn Falconet. Her desirable body weight is 49 kilos. Her total energy requirement is 1,915 calories. Carbohydrates, 287 grams. Protein, 72 grams. Fats, 53 grams. Here is the meal plan for Mrs. Rovelyn Falconet. Breakfast, AM snack, lunch, PM snack, Dinner. Midnight snack.
Liver. We all know what liver is. The liver is an organ about the size of a football. It sits just under your rib cage, and we all know that it is also essential for digesting food and also getting away or getting rid of your toxic substances. So we chose fatty liver. It is a common condition caused by the storage of extra fat in the liver. It is a common disease on most of the people. There are also two main types of fatty liver. This is the non-alcoholic fatty liver disease and alcoholic fatty liver disease, also called as alcoholic steatohepatitis. This is the healthy liver, and this is the fatty liver. What are the causes of fatty liver? First is medication side effects, fats in the blood, diabetes, genetic inheritance, rapid weight loss, obesity. Now, this is the symptoms of fatty liver: abdominal pain, nausea, loss of appetite, excessive fatigue, jaundice, weight loss, pale stools, dark urine. Here are some of the diagnostic procedures for fatty liver: liver biopsy, liver ultrasound, computed tomography or CT, blood tests. Now this is the treatment for fatty liver: avoiding alcohol, taking medications to manage diabetes, cholesterol, and triglycerides or fat in the blood, losing weight,
taking vitamin A and thiazolidindiones in specific instances.
Here are some of the foods allowed and not allowed. Foods allowed are fruits, vegetables, high fiber plants like legumes and whole grains. Not allowed foods: alcohol, added sugar, added salt, fried foods, red meat, white bread, rice, and pasta. Here is the demographic design of the patient. The name of our patient is Fortunato Rebano IV. The age is 34 years old. Here are his vital signs: temperature 36.8, respiration rate 18, pulse rate is 74, blood pressure is 110/70. The weight is 89.15 kg. The height is 5'7". His diagnosis is fatty liver. There are also the diet prescribed by physician. First is eat green foods. Do not eat fatty and offal foods. And lastly, do not drink soft drinks and beer. The history of present illness is unhealthy living or some cause of eating so much fats, medication, fish oil, and liver prime. The income is executive engineer. His physical activity is moderate. So here is his computation. His BBW should be 63 kg. His CER, or he should take 2,205 kcal. His carbohydrates, or CHO, should be 331 grams. His protein, or CHON, is 83 grams. His fats should be 51 grams. Now this is his meal plan. The breakfast: AM snack, for lunch, or PM snack. Lastly, his meal plan for dinner. What is hypertension? It is usually called high blood pressure, and your blood pressure is higher than normal. There are 4 stages of hypertension. First is the normal, 120/80. Then the second one is pre-hypertension, systolic between 120 and 139 mmHg, or a diastolic between 80 to 90 mmHg. Third is stage 1, systolic between 140 and 159 mmHg, or diastolic 90 and 99 mmHg. Then lastly is the stage 2, systolic of 160 mmHg, or higher diastole 100 mmHg. What causes hypertension? This common cause of hypertension includes smoking, obesity, old age, alcohol consumption. Here are the symptoms of hypertension: severe headache, nosebleed, fatigue, visual problem, chest pain, difficulty breathing, blood in the urine, and irregular heartbeat. What are the treatment for hypertension? These are some: diuretics, angiotensin, angiotensin II receptor blockers, and lastly calcium channel blockers. The other treatment are also lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. Exercise regularly, eat a healthy diet, reduce salt or sodium in your diet, limit alcohol, quit smoking, get a good night's sleep, and reduce stress. So what are the test drive for hypertension? First is ambulatory monitoring, second is lab test, third is electrocardiogram or ECG, lastly is echocardiogram. This is the foods allowed: vegetables, fish, fruits, and whole grains. The foods that is not allowed are salty foods, sugary foods, red meat, alcohol, saturated fats, sugary drinks, condiments, and lastly processed and prepackaged foods. Here is the demographic design of the patient. The name is Corazon Bismonte. Age is 64 years old. Her vital signs is temperature 35.8, respiration rate is 19, pulse rate is 80, blood pressure is 180/90. Her weight is 40 kg, height is 4'9". Her diagnosis is hypertension. Her diet prescribed by physician: eating plenty of fruits, vegetables, and whole grains, limiting sugar sweetened beverages, desserts, and alcoholic drinks, limiting food high in saturated fat, and less salt. Her history of present illness is stress-related, hereditary from mother's side. Her medication is losartan, 50 mg every morning, amlodipine, 5 mg every evening. Her income is housewife, financial support from her daughter, physical activity is light. This is her complication. Her DBW should be 40 kg. Her TR should be 1,200 kcal. She should take also carbohydrates of how many? It is 180 grams. In protein, 45 grams. Lastly, fats is 33 grams. Her meal plan for breakfast is 1 hard-boiled egg, rich in protein containing 6 grams, rich in fats containing 5 grams. 2 slices of wheat bread containing 30 grams of carbohydrates and containing 2 grams of protein. 1 small apple, rich in carbohydrates containing 15 grams. 1 cup of milk containing 8 grams of protein, and lastly, 1 glass of water. Now this is her meal plan for day and snack. 1 cup of cereal containing 20 grams of carbohydrates and containing 8 grams of protein. 1 small banana containing 15 grams of carbohydrates and 1 grams of protein. And lastly, 1 glass of water. Now this is her meal plan for lunch. 1 cup of brown rice containing 20 grams of carbohydrates, 2 grams of protein, and 2 ounces of chicken breast containing 17 grams of protein, 2 grams of fats, 1/2 cup of broccoli containing 5 grams of carbohydrates and 2 grams of protein, then 1/2 cup of green bell pepper containing 5 grams of protein, and 1 tablespoon of butter containing 5 grams of fats, and water or 1 glass of water. Now this is her meal plan for tea and snack. 1 slice of wheat bread containing 15 grams of carbs, 1 gram of protein, then 3/4 cup of yogurt containing 9 grams of protein, 1 small orange containing 15 grams of carbs, then 1 glass of water. Now this is her meal plan for dinner. 1 cup of brown rice containing 20 grams of carbs, then 2 grams of protein, then 1/2 ounce of pork containing 9.5 grams of protein and 5 grams of fats, then 1 cup of spinach containing 5 grams of carbohydrates and 1 gram of protein, and 1/2 of mango containing 15 grams of carbs, then 1 teaspoon of butter containing 5 grams of fats, and then 1 glass of water. So in hypertension, the total of CHO or carbohydrates intake is 180 grams, which is equal that should be taken by the patient. Protein is 68.5 and fats is 17 grams but should be 20 grams, but it's okay because the patient should be less in fats.
Boil the chicken and the pork and then put some butter or olive oil. Prepare it for air frying. Now we can start by air frying it into 20 minutes each side. Then prepare the spinach for boiling. Then prepare the bell pepper, cut it for small sizes. Now boil it. Prepare the broccoli, cut it for the smaller portion, and then boil it on the hot water. Time for food preparation.